Good morning everyone, my name is Vasquio Femio from BSN1 and 1A. So for today's return demonstration, I'll be demonstrating the bed bath, shampooing, oral care, and back massage for our patient. So before doing that, let's proceed first to the bed bath. So let's start. First is to identify the patient, then we're going to provide privacy and perform hand hygiene. So let's start. Good morning ma'am, my name is Vasquio Femio and I'll be your student nurse for today. May I know your name please? Birth of date?
January 2009.
How old are you?
I'm 16 years old.
Okay po. Next is perform the provide privacy. Provide privacy is to ensure the privacy of the patient and to ensure na walang mga ibang patient na ibang tumingin or nurse na tumingin sa ating patient to secure her privacy. Next is to perform the hand hygiene and use gloves or PPE if needed. By using the hand gloves and performing the hand hygiene is to secure our patient to prevent the infections na pwedeng makuha ng patients natin and to prevent din yung safety ng ating patient and para na din sa atin, mga student nurse na para sa ating safety. Okay, so we're done in hand hygiene and sa putting the gloves. Next is to explain the procedures to the patient. So, good morning once again, Ma'am Cheka. Now I'll be demonstrating I will be bed bathing you. This to ensure your safety and clean and comfortable with you. So, this take will few minutes. Okay lang po ba sa inyo yun? Okay po. So let's start na po. Before we start, ang gagawin muna natin first is the face or the eyes, then throughout her body. Ayun yung gagawin natin for her bed bath. So before we start, we're going to use the top linen so to provide her privacy na rin. Ayun po. So let's start. Are you comfortable po? Okay, so let's start na po. I'm going to use the hot compress or mid compress to her body para hindi ka mainitan or malamigan yung patient natin para natin sa comfortable na temperature niya. So after the face or eyes, let's proceed to the chest, arms, and tummy throughout her body. So labas po muna dito ma'am. And pinalik ko po sa ilalim para hindi po mabasa yung kama or para maging comfortable yung patient natin. So let me put this po. Okay. After the arms, let's proceed to the down, sa down ng body niya po para malinisan din po natin. So, ano pa lang po ito, ma'am? Next po, kasi nito pa. So, after that, let's do not forget the back side of our patient. So, ma'am, can you pwede po kayong tumingin doon na side para po malinis natin yung ano niyo pa. Okay, so, okay. Yan lang po ito, miss. Are you comfortable po? Opo. Okay po, wait lang po, ma'am. Okay na po, ma'am. Basta po. Next is after to wet the patient or bed her, let's proceed to drying. Let's dry towel po para yung basa sa katawan ng ating patient para hindi siya maka-adapt ng mga new organisms na kumakalat through airborne or infection na din po is para maiwasan yun. Okay, so this is dry towel po ma'am para maiwasan po yung magbasa po ninyo and comfortable po kayo, okay? So magpo-proceed lang po ako dito sa bottom nyo. Next po, ang pasay na rin po. Okay po, now is okay na po yung sa pag-dry natin sa patient natin and do not forget to cover her body for her privacy. So after that, kukunin natin yung patient's clothes para makapag-lis yung patient natin. Okay, ma'am. So, paangat na lang po yung kamay and ito. So, susunod natin ganito. Sige ma'am, isa pa po. Ano po na po? Okay po. Then after that, na nagamit nating all linens is ilagay siya sa tamang lagayan para din hindi maguluhan yung ating maintenance or yung mga naglinis sa bawat room and para din sa safety ng ating patient since okay na siya at nakapagbihis na siya. So, after na malagay yung pinas natin sa tamang lalagyan is, maglagay na tayo ng top linen for our patients. Top linen or di kumot. Ayan po. So, that's for all. And before we proceed to the next procedure, do not forget to remove your gloves and perform hand hygiene again. So now, let's proceed to the bedside shampooing for the patient. So, explain the procedure to her para alam niyo yung gagawin natin and para hindi siya mabigla kung ano man yung mga body parts or gagawin natin dapat sa kanya. So, let's proceed that. Good morning, ma'am, again. So, I'll be bed bathing you or shampooing your hair and scalp to prevent or to clean your hair since you are on the bed rest. Is that okay with you?
Yes.
Okay po. So, before we doing that, let's proceed to our hand hygiene para ma-prevent ulit yung mga infections or diseases na maaaring umadapt sa ating patient. So, all equipments are gathered now. So, let's proceed to that. Let's proceed to the procedure. We need the plastic for our patient para dito sa hair niya. So, ma'am, babaan na po natin yung ulo niyo po. Ay, sila po natin sa ulo. Okay. Are you comfortable pa? Opo. So, let's put na po sa kanyang ulo or on the hair para maiwasan yung pagpasa ng ating unan and para comfortable yung patient natin. Tapos, lang po ito. Next is, have a towel to sa ulo niya or to her head para hindi mapunta yung water through her face and para maging comfortable yung ating patient. So, we're going to use the warm water for her hair and scalp. Okay, let's proceed. So, by doing the shampooing, so first is the scalp, then through her hair para yung germs sa kanya or yung dumi sa hair niya is mawala and para din sa safety ng ating patient. So, side na po kayo na konti, ma'am. And para hindi mabasa yung floor, we have the basil para sumalo doon sa water or the shampoo ng ating patient na nagamit na. So, hindi ko po siya malalagay dahil may nakaharap po, pero ganun po yung dapat natin gawin na may kailangan po may sumapo sa water para hindi mabasahan yung lapad and sa safety na rin natin as a patient. Okay, so after that, we're going to remove the plastic under her hair or head. Then, pupunasan lang natin yung hair ng patient para sa dryness ng kanyang hair and scalp and ilagay natin siya sa comfortable place or her comfortable bed place. Okay, let's start. Isa lang po ito. Okay po. Wait lang po. Yung side po, wait lang. Wait lang, sa kasap. Okay. Babalik ko na po ba sa panoon? Okay. Comfortable na po kayo? So that is for performing the oral care for our patient. So first is to explain the procedure to our patient. So ma'am, I'll be your student nurse again. So I am Miles again. So next na gagawin natin is your oral care. So this helps to prevent germs on your gums, teeth, and about your mouth. So is that okay with you?
Yes.
Okay lang po ba na ako po yung mag-tututbrush sa inyo para mas okay po and para hindi na rin po kayo mahirapan?
Okay lang.
Okay, thank you po. So the all equipments are gathered na. So let's proceed na sa ating procedure. So we need a towel para sa ating patient, para sa kanyang chest, para hindi mabasa yung kanyang body or para hindi magtapon-tapon yung water or the Colgate na gagamitin natin. So, okay. Tapos po yung konti. Okay po. So, next is the Colgate and the toothpaste of the patient. Nalagay na po natin siya. Okay po. So, before ano to sa patient, lagay po natin siya sa tamang lagayan. Then, perform a hand hygiene and wear gloves. Okay, so let's start. So, meron tayong basil para sumalo or kung meron tayong small na bottle like this, pwede natin siyang i-use para dito mag-spit out yung ating patient. So, let's start. Yung taas mo konti. Okay. Comfortable ba na pa? Okay, so, first is the teeth, then the gums and tongue. So, proceed na po ako kasi, first base is yung teeth, then your gums po, then you can show your tongue po. Okay ma'am, so, that's all. Can you spit out here? Okay ma'am, thank you. So, punasan na po natin yung mouth niyo. Okay po. So, ulit ako sa yung comfortable piece na po. Ayan, so, ayun lang yung sa oral care po. Then, do not forget to remove gloves again and perform hand hygiene. So, on the last procedure, we're going to massage our patient's back to prove her comfortability and ma-check natin if there had a redness or swelling in our patient's back patients. So let's start the procedure, but before we start, let's explain the procedure to her or to our patient. So I'll be performing, or finally, this is the last step of our procedure. I'm going to back massage or masahihin po yung likod nyo para po sa comfortability and para din po makita natin if para po maging comfortable po kayo, and yung likod nyo po, if may masakit po is maaari po natin ma-identify agad and to malaman po ng doktor, and that's all po. Okay na po kasi inyo yun. Okay po. So, before we start po, let me sa side po kayo mag-position ulit, then bend your knee po. Okay. Okay lang po kasi inyo, may tataas po na dito. Okay, wait lang po. Okay, relax na po kayo. Okay. So, after po itaas natin yung clothes ng ating patient sa back of her body, let's apply the warm lotion for her back, then massage gently, circulation, or either up and down para makita natin if there had a swelling or redness to her back. So, let's proceed. So, gusto na po ako. So, before na takpan natin yung patient natin ulit, get a towel para punasan yung likod. Okay, after that, reposition the patients again, and lagyan po ng kumot o titaplinin para comfortable yung patient natin. So, pagkakot na po ito, and back po tayo sa dating position niyo. Okay. Comfortable na po kayo. Okay. So, lahat na ginamit na linens or towel, ilagay or dispose na sa tamang lagayan, then perform hand hygiene again. So, that's for all for our returning demonstration about bad bathing, oral care, shampooing, and back massage to our patients. So, thank you po.